Happy Wednesday. We are going live. We are live. Hi, my name is Jennifer Waters. And although I am part of the CNY fertility team, I'm not in CNY right now, which is maybe why I feel just a little bit happier because where I am, it's a little bit warmer, which always makes me happier. When you're already happy, it's easy to get happier. I can tell you that for sure. So, anyways, I'm here today to share some information with you about the third of the fertile secrets, which I have been contemplating now for at least this lifetime, probably more. It's hard to say. One of the things I really like to do is understand kind of the pulse of information that is available to you nationally and internationally. What are the experts in the field talking about so that I can think about the things that they're not talking about to fill in the gaps, possibly. That's what I like to do, is fill in the gaps. So I've spent a fair amount of time trying to understand the true cause of certain disease patterns, in particular, things related to fertility, in particular, uterus health, and in particular, endometriosis, which I believe is for sure in the autoimmune category, but not in the way that you are thinking about autoimmune. If you believe that autoimmune is your body attacking itself, which is a very personal thing, then I want you to reconsider that way of understanding that definition. So I like to use the letter C for a lot of the things that I think about, like cause, cure. So I want us to begin by understanding like the correct view of your body, and to really try to encourage you to feel the truth, which is that you can heal. Okay. Now, when I talk about that you are infinitely, brilliantly designed to heal, that doesn't mean that you're going to go off and get blood work and that tells you that you're healed, or you're going to go get an ultrasound and that's going to tell you that you no longer have ovarian cysts or whatever. I'm talking about trusting your body, knowing that you are designed to heal. And sometimes that healing simply means that you are asymptomatic, right? So if you have, let's say, a herniated disc in your back, and you're not going to do surgery or anything to correct that, you may be able to live the rest of your life with herniated discs and no symptoms at all, right? So is that a cure? In my mind, it is, because you're not having symptoms. It's not defining what you do during your day, during your life, during your holidays or whatever. Of course, you have to be aware that this is a weak link in your body, and it may always be a weak link, but that should be very easy to manage. That's not a lifestyle thing. So I want you to know that you can cure yourself, right? That is within your ability. Lots of people have, and I've met them, and you're no different than them, right? So we are ultimately all the same. We all want the same things. We have very similar desires, and our chemistry is the same. What's different is our DNA and our lineage, but even those patterns tend to be the same. Ancestral burdens, it's very similar, family to family, lineage to lineage. Okay. Those of you that are already parents know that. You can see like, oh, wow, my son or daughter has this and I have that. And how does that happen? And how can we make that change? We absolutely can. It's not a confirmation that you have something that you're going to pass that down to your child. A lot can be influenced. So the other thing is causation. I want you to, if you've been diagnosed with something, whether it's endometriosis or any kind of autoimmune pattern, I want you to personally get involved with the cause of that. I always ask people, what do you think caused your whatever? And 100% of the time they say, the doctors don't know. WebMD doesn't know. Google doesn't know. How should they know? They're not your body, right? So I ask these people, I ask you this question because I want you to ask yourself, what do you think caused this? Be curious. Do it in an open-minded way that helps you to connect with yourself, okay? When the doctors say, oh, it's idiopathic, you know what that means? No cause, no cure. That's not the world that I live in. There's always some cause, right? If we're open and we're a little bit creative, and if you have a little bit of a sense of humor, that helps. And the cure, again, we're going for asymptomatic here, or we want to prevent things from getting worse. Sometimes the cure is, okay, I can live with this the way that it is, and let's not let it get worse, right? Because right now I'm good with the way things are. So let's prevent things from getting worse. These are very tangible, attainable goals. So, and the other thing that's really important for, and it's always minimized, is that your emotion is fueling your biochemistry, right? It's not just that how you feel matters. And if you're having a bad day, that's going to affect the people around you. And if you feel like you have self-loathing today, maybe you're going to end up with a headache. And all of that is true, possibly. But it's more than that. It's your emotions are fueling your biochemistry. That means that your hormonal balance is directly impacted by your thoughts and your feelings, right? We think and we feel. There's a bit of a disconnect there. One of my favorite teachers a couple weeks ago, he was talking about using the breath to let go of negativities. And he said that he visualizes himself bypassing the brain. If he's bringing in divine light into flooding his system with light, he breathes directly into his nose and into his lungs to bypass the problem, which is our thinking mind, right? So I like that. So I'm going to encourage everybody, try to get out of your head. Let's get into the body. Use your breath to directly inhale into your lungs, which are behind your heart. So it's all connected, okay? We all think too much. I know I do. And so when you use your breath to get right into your body, into your heart, this is where all of your information is. Your heart knows. And if you're wrong, so what? Who cares? Just be open, be curious with yourself, and try to figure out, okay, well, maybe there is something that occurred that could have caused this, okay? And then it makes the cure a lot more easy to apply. And remember, everybody is so personal. We have to customize what is going to work for you. Because if somebody over here has endometriosis, their cause is going to be completely different than yours, okay? Now, it's a very common diagnosis, right? I'm sure those of you that are listening know that you have it, and now you're talking to everybody and everybody has it. So we have to ask ourselves, well, why is that? Is it because technology is new and now we're able to diagnose more quickly? Or is there a bigger concern here about why is your uterus developing this, what I call autoimmune condition, to allow your endometrial tissue to be forced out of the lining, out of your uterus and into your lymphatic system, into your reproductive organs, possibly into your lungs, into your brain. This is serious, as you know. Here's a quick question. What is the one organ that they have never found endometriosis on? That's a question. What is that one organ? That organ is the spleen. Why is that? I've asked a couple people and I feel confident in the answer. It's because the spleen is a part of the cure. Strengthening your spleen is absolutely going to help prevent endometriosis from occurring if you don't have it. And it's going to help treat you if you do have it, and it will absolutely prevent things from getting worse. And we can also help to manage pain connected to endometriosis there's many ways to strengthen the spleen. So back to causation, right? So we have to look at our emotions. The emotions are fueling your biochemistry. Do not underestimate feelings of longstanding grief, of longstanding betrayal, of frustration, of anger, okay? All of this is living inside of you. So I want you to figure out how you are going to get this out, to let it go so you can be free and move on. If you're triggered, what I do is I notice my triggers. I'm standing in line. I'm already frustrated because I want the person in front of me to go faster or whatever. That's on me. That's not them. That's nothing to do with them. I have to manage how I am feeling. Why am I responding this way? And the more I change my feelings, the more it affects how things are going to go in my life and in that line in the grocery store. It's really kind of fun when you get to a place where you really have patience for yourself and others. You can kind of experiment with that. Anyway, so that's a digression. So we have causation related to your stuck negative emotions. It's not that you're having negative emotions, it's that they get stuck, right? Bad things happen to good people. They come and go. That is how we adapt, and that's fine. It's when we hold on and we can't let go. That's when it's a problem. We have organ function, right? So how is your uterus functioning? Is she in a proper location? I talk about this all of the time. Location, location, location of the uterus absolutely matters. If you have a retroflexed uterus, that means you are set up for endometriosis because the lining is unable to shed freely out of the uterus during your menstrual cycle. So what happens is the old endometrial tissue doesn't shed completely. The new endometrial lining forms on top of it, and now we have a problem, right? So it can be easily pushed out through the uterine walls. This is sort of like leaky gut of your uterus, right? So everybody's heard the term leaky gut, right? In the gut, it means the junctures inside your large intestine and small intestine have lost some of their integrity so that nutrients are now leaking out into the blood. We can call this autoimmune. The same patterning happens with your uterus. So, but we also have to ask ourselves, why are the ligaments not doing their job? Because as you know, the uterus is a suspensory organ. She is designed to go from the size of a pear to a watermelon and back down. So if the ligaments are not strong enough to hold the uterus in place, why is that? Your neighbor may not have a problem with it. If you do, we have to say, why? What are you missing? It's usually a vitamin C deficiency, a whole food vitamin C complex. That is the nutrient of that tissue type. Ligaments are part of the connective tissue layer. Ligaments are connective tissue, and they need whole food vitamin C complex to maintain their integrity. That is not ascorbic acid, right? Ascorbic acid is synthetic isolated vitamin C. It is not vitamin C. It is not going to help you. In fact, it's probably causing damage to you. It's causing more harm than good. So please don't take ascorbic acid thinking that you are nourishing your ligaments and you're going to hold your uterus in place. Absolutely not. So if you reach out to me, I can share more information with you about the best quality supplements that are available. And some of you already know. So back to causation. So we have to look at hormone imbalance. Why are you having, usually it's an estrogen dominance pattern, right? And that's what is causing the pain during your period. So why, all of that generally comes back to the liver. How well is your liver functioning? If you're not processing, synthesizing this estrogen well, it's usually because you've got blood stasis in the liver. You've got something compromising your liver. So increasing your glutathione levels, putting a little bit of lemon in your water in the morning, working on the liver, getting those bitter constituents into your diet can help a lot. You definitely want to support your gallbladder with enough bile flow. It's interesting. I was just listening the other day, a lecture on bile, one of my favorite subjects, gallbladder bile. I'm pretty boring, actually. The stomach is acid. We want to have a lot of acid in the stomach to digest protein in particular. Those of you that are doing keto carnivore, please, please, please make sure you are on the acid side of life, not alkaline. You need to acidify to digest and absorb protein in particular and nutrients. Well, bile is actually alkaline. So it makes kind of a perfect synergy in your GI tract to have the acid of the stomach, the alkaline of the bile, bam, together you can digest and absorb. It's not just about digestion, it's about absorption. So there's that. And then there is some, we need to look at, in terms of causation, like we already talked about, specific micronutrients that are you're probably not getting in your diet. Vitamin C complex is one of them. And then the other thing, if we're looking at causation of endometriosis, is damage, right? So if you have had an invasive procedure, it doesn't mean that it's bad. For example, an egg retrieval is invasive. Well, you need to do that. If you're doing IVF, you have to do this, unless you're doing egg donor, you have to do an egg retrieval. Now, this is an invasive, necessary procedure that is setting your ovaries up to have an autoimmune reaction. So it's often the perfect storm. It's not usually one thing that causes autoimmune and endometriosis. It's usually a couple things layered, and that's what tips the scales. So everything's fine, and then you fall on the ice or you fall down the stairs, and now your uterus is out of alignment. You're not taking whole food vitamin C complex, so your ligaments, your connective tissue is a little bit weak. So now two things have happened. Your uterus is out of perfect alignment. It's pulled the ovaries because they're connected, the uterus and the ovaries. When the uterus moves, those fallopian tubes, which are very, very tiny, very, very easy to influence, they yank on the ovaries. The ovaries like, wow, okay, now we have a different view. We're over here. And then you don't have the nutrients that those ligaments need. The ligaments are like, we're not doing any extra work. I mean, give us a break. We're doing what we can with what we have. So bam, now you have a procedure. Let's say you have a history of fibroids, or you have something going on, or you're doing an egg retrieval. Now you have something invasive coming on. So we have some damage to the tissue. So absolutely, those three things alone, then you add in like, oh yeah, I was exposed to heavy metals, or I've been eating out of aluminum cans my whole childhood, or whatever it is. So now you layer in some toxicity in the form of heavy metals, or you have a history of BV or other kind of bacterial or viral infection. Bam, this is the perfect storm. So you're set up for endometriosis, which literally means the blood endometrium is outside of where it should be. So that all makes sense. And of course, not many people are talking about the cure. So the first thing, before we get into the cure, if you're working with a practitioner, I want you to stop and take a few moments and see if you connect emotionally with the cause, okay? Because here's the thing, and I've talked about this a lot before, I want you to get a diagnosis from whatever practitioner you're working with. If you're working with an acupuncturist, people are investing a lot of time, energy, and money into working with practitioners in the fertility field and all fields. You owe it to yourself to get a diagnosis, because it's what you do every day that's going to accumulate in your life and make the lasting change that you need, okay? So if you know you've got autoimmune of the uterus and it's because your spleen is weak and your connective tissue is not getting what it needs, okay. Now you've got something that you can work with all the time. It starts in your mind. It starts with your imaginations, with your creativity, then your nutrition, then your targeted supplements. The spleen loves to sing. It loves certain colors, the color orange. It loves the flavor of sweet, not, candy and stuff. It could be other versions of sweet. So these are things that you can do every day to support yourself. So it's really important that you get a diagnosis and you start in a more creative way, embracing the cure in your mind, in your thoughts, in the decisions that you're going to make, in the temperature that you keep your room, in the humidity, I think you get the drift here. So, in a lot of times, you can use your creative mind while you're trying to fall asleep, and you can start visualizing exactly what you want to occur in your body. And it's a nice way to start embracing the change. You're very clear in what you want happening. And that's very different than idiopathic. We don't know what caused it, and there's no cure. Talk about feeling hopeless. Like, geez, there's nothing you can do. That's just not even logical. There's always something you can do, always. So give yourself that gift. Really encourage your practitioner to give you the diagnosis in a simple way, in a way that makes sense to you, that you can apply in a practical way. And then let's start diving into, would your body actually attack itself? That would be the ultimate betrayal. The body does not attack itself. It attacks foreign objects in the bloodstream that should not be there. That's what's being attacked, right? So it's a little bit of a longer discussion about the proteins in the blood, how they got there. It's from a weakness in the cell on the cellular level, and that could be a mitochondrial dysfunction. That could be from bacteria, heavy metals, and viruses, but it could also be the miracle molecule nitric oxide, which is what's released into the blood when you do LED light therapy. The way it was explained to me is that nitric oxide can actually get jammed up in your mitochondria. And when you use light therapy on the body, it releases that nitric oxide so that your mitochondria are now functioning better, which means that whatever you're taking, whether it's a pharmaceutical drug, whether it's a progesterone and oil shot, or whether it's the most natural form of vitamin C, all of that is going to be absorbed better. So when you fix yourself, when you heal yourself, when you repair the mitochondria, which are more dense, by the way, in your ovaries than any other tissue in your body, now you're really giving yourself the support that you need to repair the cells, right? So that's what we have to do. Get the cells to function better so that things are supposed to stay in the cell, and they're not leaking out into the blood, because the immune system is protecting you. It's not attacking you. It's coming in and saying, well, this shouldn't be here. Let's come on in and get rid of this to save the host, which is you. But what happens is it gets punished. It's like, oh no, this is the body attacking itself, so we have to downregulate the immune system. No, let's not do that. Obviously, I want you to follow your doctor's orders here, and just want you to think about things a little bit differently. So maybe we could change some outcomes here, especially if you have the diagnosis of endometriosis and you are doing a transfer now, and you have a history of miscarriage. So endometriosis diagnosis means you are at risk for a miscarriage. They are connected, right? The body is unable to hold things in its place, whether it's endometrial tissue or an embryo. We need to strengthen the uterus and to strengthen the cells of that. And we have these techniques that are available that will assist you to do that. So it all comes back to fixing your cells on the cellular level, obviously, strengthening the spleen. There's some very targeted, short-term, affordable protocols that you can do, and also making sure your liver is flowing well. We don't want a blood stasis pattern. We don't want clots. We don't want things to be congealed. So we want to take a look at all of that. Okay, everyone, let's see if I have any questions here on Facebook. You can, thank you, Jennifer and Ethan. You can try, I'll try to answer your question. I don't know if I can. If I have to hang up, I want you to email me, okay? I'm gonna post my website here for you, jenniferwaters.net, and reach out to me, okay? I'm putting together a little ebook for all of you about the 7 fertile secrets. It's kind of a random number that I chose. There's a lot more than 7. And the reason that I call them secrets is, well, because it's not that well known information out there in the fertility world. Some of it is. So anyways, you let me know what you think. I'm here for you. Please be kind to yourself so that you can be kind to each other. Thank you for your interest in health and in life. And may all of your dreams and wishes come true. All right, I'm going to say goodbye to Instagram. And I'll give you my website here in Facebook. All right, everybody, take care.